what is going to happen today with the legislation on health care?
Well, as you know, we've made some tweaks to it to improve it over the last 48, 72 hours. We'll do a rule vote this morning at some point, and then at some point today, we're going to vote on that bill.
Do you have the votes?
I'm not the whip, so I can't tell you what the number is, but I can tell you that we're going to get this across the finish line today. I'm very confident.
How many more votes do Republicans need to get this across?
Well, if I knew that, I'd be able to tell you how many votes we have, but I just really don't know. I know that some members are still trying to make up their minds, and for some members, this is a heavy lift for them. And I get that, but at the end of the day, this is what we promised the American people we were going to do.
What about concerns that this legislation would harm senior citizens or lower-income Americans? What's your response to that?
Well, we're putting safeguards in there to make sure that doesn't happen. We're pre-existing conditions, that clause is still in there. Insurers can't deny coverage based on pre-existing conditions. We're giving tax credits to make sure that people have the ability to purchase the insurance policy that they want. We've put money into, over the recent days, we've put additional money into the Patient and State Stability Fund for mental health, for maternity care, for addiction recovery, and those kinds of things. Very, very important that we do that.
Congressman, some conservatives are saying, hey, wait a minute, take a deep breath, take a step back. Let's have a few more days to work this through, because top conservative groups have said this bill is not conservative enough. Should the vote be today, or should you wait a couple more days to have this
No,
vote?
we should not wait. And what those groups are forgetting is two things: that this is step number one in a three-step process. You got to get step number one done before you can do steps 2 and 3. Number two, they are forgetting, I believe, and grossly underestimating what the response to the free enterprise markets in our country is going to be when the shackles of Obamacare are taken off and the markets are allowed to respond. You're going to see insurers that are clamoring to get back into the industry. We are assuming, some people are assuming, that the cost of a health insurance policy 5 years from now is going to be the same price as the exorbitant premiums of Obamacare today, and that's just not the case.